Welcome to Aawaz, Voices from the Field, a podcast series on quality improvement by Nationwide Quality of Care Network, supported by UNICEF India. Let's listen to a QI story.
Improving a scheme is never a task too easy for any institution, especially in a broad scope of health. Therefore, quality improvement models are very much essential in creating development in medical sector. Hi folks, this is your host Neelu Suri, and today we have a very special guest who will enlighten us with the impact of quality improvement approach in her practices. Hi Mikki, how are you doing?
Hello, ma'am. I'm fine. How are you?
That's great. I'm too fine. Mikki, tell us something about yourself.
Myself, Mikki Khan. I'm working as an assistant professor in Rufaida College of Nursing, Jamia, Hamdard. I have more than 18 years of teaching experience in the field of obstetric and gynecological nursing.
That's great, Mikki. Mikki, tell us that as to who and what inspired you to have training in such a highly specialized area of quality improvement.
I have received an opportunity to attend a workshop through Ms. Jeena Pradeep, which was on quality improvement. Then I have attended training of trainers, which was organized by NQCN under the guidance of Dr. Vikram Datta from Kalavati Saran Hospital, New Delhi. Witnessing the hard work done by NQCN team inspired me a lot, and I can say with pride that they have been my inspiration for this project.
Mikki, tell us what were the skills you acquired from that training?
The training program refined my confidence, and I came to know about the various aspects of quality improvement. By this training program, I came to know about how to review the data to identify the problem. Second, how can I prioritize which problem to do work, and how to form a team, work on that problem, and how to write a clear aim statement. So I came to know about how can I identify the problem and how to solve that problem.
That's great. Mikki, then I'm sure that training must have proved beneficial to you, is it?
Yes, sure, ma'am. It brings a lot of impact if actually practice in real scenario. The best thing I have learned from the quality improvement workshop is that we don't need to be on the top of the administration, but look out for opportunities that we can provide. The workshop provided me a platform to bring out the actual framework and to do something which was in my mind and logging for years. We sometimes feel bounded specifically to our duties and objective, but quality improvement workshop will help me to do something out of my capacities.
Me that when you came back to your institution after undergoing the specialized training program, how did you integrated that study with your practices?
After getting a training program, I have organized 2 days quality care workshop having many practice sessions which made things more clear, where I understood we need to improve quality without bringing any financial burden to the institute, and also it should not interfere with the system. Instead, it should add on for betterment of the institute.
That's great. Mikki, you have chosen a very specific project. You mentioned that after you came back, what was that project, and what made you to select that specific project?
I have chosen one project. So name of the project was 1 minute life savior. And I applied the strategies in my clinical area by introducing a project on one of the problem which I had identified in my experience. So I would like to highlight on such observation which later become my focus for bringing improvement.
Okay, so what you did after identify that problem, and what was the problem?
I have made a statement of the problem, and the problem that I have realized in labor room, like mothers, they are not getting uterotonic drugs, which is injection oxytocin within 1 minute of time. So I found that problem has to sort out.
So what you did then? How
So
did you manage? How you motivated the people all around?
So I have made aim statement for that. So by this, I made a aim statement that we will going to increase the percentage of women receiving uterotonic drug within 1 minute after vaginal delivery, and it was found that it was 50%. Only 50% mother they are getting a drug just within 1 minute. So I made aim that 100% mother should get the uterotonic drug within 1 minute.
Okay, for that, what you did you motivated people all around, or what specific thing you did?
I have used fishbone diagram to identify the problem with what all reasons are there why mother they are not getting a drug. Then I identify the lacunae or room of improvement, and that is indent of oxytocin in advance under the supervision of the hospital staff. Then students who were performing delivery were pre-informed about the name of the 60-second in charge. Now, 60-second in charge was supposed to preload the injection and keep it near to the delivering mother. The in charge used to make sure that it is administered immediately within 1 minute. The name of the mother was noted down and it was recorded immediately. So the mother will not have chance for the postpartum hemorrhage.
What kind of message you would love to give to our listener who are listening you? And since you have already become role model for your institution, what special message from your side?
I feel privileged that I am a part of quality improvement team, and the sensitization provided by quality improvement helped me a lot to implement the project, which were just in my thoughts and come into the existence by getting exposure of quality improvement. And the message I would like to give is that we should not restrict ourselves to what we can do just by thinking or feeling improvement can come only by changing the system. Rather, we should continue with our small effort, which will definitely bring a change.
That's great. Thank you, Mikki, for being part of this program.